The experience of sciatica is both physically and mentally disruptive, especially for those over 60, because it intertwines nerve sensitivity, muscular tension, and spinal mechanics in ways that can make even simple movements a source of discomfort. At its core, sciatica is rarely an isolated problem with the nerve alone. It is the result of multiple structural and functional factors that converge along the lower back, pelvis, and legs. The sciatic nerve, the largest in the human body, runs from the lower lumbar spine, through the gluteal region, and down each leg. When this nerve becomes compressed, irritated, or inflamed, while medications can mask the sensation temporarily, they do not address the underlying causes of compression or tension, and their effects are fleeting. What science and clinical observation increasingly demonstrate is that a carefully targeted exercise can achieve immediate and sustained relief by addressing the root physical factors rather than simply suppressing the symptom. The principle behind this targeted movement is the creation of space and alignment along the nerve pathway. In many cases, sciatica results from compression caused by tight muscles, misaligned vertebrae, or pressure from inflamed soft tissues. The piriformis, hamstrings, and lower back muscles can become chronically tight, pulling on the pelvis and restricting the natural glide of the nerve. A focused exercise that elongates these muscles in a controlled, gentle manner allows the nerve to move freely, reduces mechanical irritation, and decreases the firing of pain signals. The body interprets these signals as a release of tension, often producing relief within minutes. Unlike pills, which temporarily suppress perception of pain, movement changes the physical environment surrounding the nerve, addressing the mechanical root of the problem and signaling the body that it can move safely again. The design of this exercise is informed by an understanding of anatomy, biomechanics, and neuromuscular function. Small, precise movements target the gluteal region and lower back, activating stabilizing muscles while stretching tight tissue. By engaging specific fibers in the core, glutes, and hip region, the exercise redistributes forces away from the nerve. It is not simply about stretching in the conventional sense. It is about coordinated activation, elongation, and alignment. When the body performs these movements consistently, surrounding muscles learn to support the pelvis and spine more effectively, reducing the likelihood of recurrent nerve compression. This approach reflects a shift from reactive treatment to proactive biomechanical management, emphasizing that the structure of the musculoskeletal system plays a critical role in chronic pain reduction. Another important dimension is the immediate feedback the body provides during the exercise. Because the movement directly affects the nerve's pathway, the nervous system detects decreased tension and irritation, which reduces nociceptive signaling, the process by which the nerve communicates pain to the brain. This mechanism explains why individuals often feel relief faster than with oral medications. The exercise does not anesthetize the nerve, it removes the source of irritation, allowing the nervous system to recalibrate. Over time, this reduces hypersensitivity and retrains the body to tolerate normal motion without triggering pain. The feedback loop between mechanical correction and nervous system adaptation is what makes this single exercise particularly powerful for seniors, who may otherwise experience prolonged stiffness and discomfort due to sedentary lifestyles or age-related muscular decline. Additionally, the exercise improves circulation in the lower back, glutes, and legs, which enhances tissue repair and reduces inflammation. Blood flow delivers oxygen and nutrients to strained muscles and compressed nerve tissue while clearing metabolic byproducts that contribute to pain and swelling. As even a few minutes of this targeted movement stimulate vascular exchange, which supports both immediate relief and long-term resilience. This vascular effect is subtle but essential. Chronic inflammation can perpetuate nerve irritation, and by increasing local circulation, the exercise creates a physiological environment conducive to healing and functional recovery. It is a multidimensional intervention that simultaneously addresses mechanics, neurology, and cellular support. Importantly, the exercise is accessible and low-risk, which makes it particularly suitable for older adults. Unlike high-intensity regimens or invasive procedures, this movement respects the natural limitations of the aging body. It can be performed in a chair, on the floor with support, or while standing, depending on mobility and comfort. The gentle nature of the movement ensures that muscles are lengthened without overstretching, and the spine is supported rather than forced into positions that could exacerbate symptoms. The emphasis is on slow, controlled, intentional motion, which allows the nervous system and musculoskeletal system to adapt safely and effectively, reinforcing the principle that even minor, well-designed interventions can have profound effects when consistently applied. By focusing on the structural, mechanical, and neuromuscular contributors to sciatica, this single exercise demonstrates how a simple, scientifically informed intervention can produce rapid relief and long-term benefits. Unlike pharmaceutical approaches that mask pain or invasive procedures that carry risk, the exercise works with the body's natural anatomy and physiology, creating space for the nerve, improving muscle function, enhancing circulation, and providing immediate feedback to the nervous system. Its effectiveness lies in precision, consistency, and the understanding of how interconnected muscles, nerves, and joints influence chronic discomfort. For seniors over 60, this means that pain is not a permanent limitation. It is a signal that can be addressed through deliberate movement, opening the door to renewed mobility, confidence, and freedom in daily life. The second key principle in relieving sciatica pain lies in the concept of neuromobilization, a process that focuses not only on muscles and joints, but on the nervous system itself. Recognizing that nerves are dynamic tissues capable of adapting to movement when approached correctly, the sciatic nerve, the largest in the human body, is encased within layers of connective tissue and travels from the lower spine through the pelvis, buttocks, and down the leg. When compressed or irritated, it sends pain signals to the brain, producing the characteristic radiating ache associated with sciatica. Traditional approaches often focus on symptom management, such as medications or rest, but neuromobilization addresses the source by gently guiding the nerve along its natural pathway, reducing mechanical tension and promoting proper gliding. This approach is rooted in a deep understanding of neuroanatomy, biomechanics, and tissue responsiveness, illustrating how the nervous system interacts with surrounding structures and how carefully controlled movement can restore function. The mechanics of neuromobilization are subtle, yet profound. Nerves are not rigid. They're designed to stretch, glide, and adjust to movement. However, years of sedentary behavior, muscular imbalances, or minor injuries can restrict these natural motions. Scar tissue, muscle tightness, or spinal misalignment can compress the nerve or limit its mobility, creating repeated irritation and hypersensitivity. By engaging in controlled, precise movements, individuals encourage the nerve to glide freely, decreasing localized pressure and irritation. Even a simple extension or gentle leg raise performed with mindfulness and alignment can generate enough tension to stimulate adaptation without exacerbating pain. This re-education process teaches the nervous system to interpret movement as safe, reducing the excessive firing of pain signals and decreasing hypersensitivity over time. Neuromobilization is particularly powerful because it addresses both the peripheral and central components of pain. Peripheral sensitization occurs when the nerve itself becomes more responsive to stimuli, causing even mild movement to trigger pain. Central sensitization involves the nervous system and the spinal cord and brain becoming overly reactive, amplifying pain signals. When the sciatic nerve is mobilized correctly, peripheral tension decreases, which in turn dampens the exaggerated central responses. The body begins to recalibrate its perception of movement, and activities that once triggered discomfort become manageable. This neurophysiological process underscores why a consistent, well-structured neuromobilization exercise can provide immediate relief while also producing long-term improvements in function and mobility. Another dimension of neuromobilization involves the integration of surrounding muscles and joints into the exercise. While the nerve itself is the focus, the surrounding tissues, gluteals, hamstrings, hip flexors, and lumbar muscles play a critical role in maintaining proper alignment and reducing compressive forces. Coordinating the activation and stretching of these muscles while performing neural glide exercises ensures that the nerve moves within a supportive, tension-free environment. This synergy between muscle activation and nerve mobility not only alleviates pain, but reinforces proper movement patterns, allowing the body to adapt in a balanced way. The exercise becomes a holistic intervention, engaging the nervous system, musculature, and joints simultaneously to optimize function and reduce the likelihood of future flare-ups. Circulation and cellular health are enhanced during neuromobilization as well. Gentle motion increases blood flow to the nerve and surrounding tissues, delivering oxygen and essential nutrients while removing metabolic waste and inflammatory byproducts. Improved vascular perfusion accelerates the healing process, supporting both immediate symptom relief and long-term tissue resilience. The nervous system is highly sensitive to metabolic changes. Even mild improvements in oxygenation and nutrient availability can reduce inflammation, improve conduction velocity, and stabilize nerve signaling. This illustrates the multi-layered effect of neuromobilization. It is not simply a mechanical intervention, but a strategy that integrates physiology, vascular health, and neurobiology. Consistency and mindfulness are crucial to maximize the benefits of neuromobilization. Performing the exercises slowly and deliberately ensures that the nerve glides along its natural path without overstretching, which could otherwise exacerbate irritation. Each repetition reinforces safe movement patterns and rebuilds confidence in mobility. For older adults, particularly those over 60, this approach respects the aging body's limitations while encouraging adaptation, demonstrating that even subtle and tensional movements can recalibrate the nervous system and restore function. Neuromobilization teaches the body that motion is not a threat, counteracting fare avoidance behaviors that often accompany chronic sciatica. The evidence supporting neuromobilization emphasizes its efficacy. Clinical studies and practice indicate that carefully executed nerve glides reduce pain intensity, improve range of motion, and enhance daily functional performance. Unlike passive treatments, which rely on external forces or medications to alleviate symptoms, neuromobilization engages the body's inherent adaptive capacity, producing both immediate relief and long-term neurological reconditioning. It highlights a central principle in pain management. Nerves are dynamic, living tissues that respond to appropriate mechanical and physiological stimuli, and their function can be restored through guided, intentional movement. Incorporating neuromobilization into a daily routine transforms the approach to sciatica management. It shifts the focus from avoidance, reliance on medications, or passive therapies to active participation, empowerment, and neurophysiological restoration. By understanding how the nerve moves, how it interacts with surrounding structures, and how it adapts to controlled motion, individuals gain a powerful tool to interrupt the cycle of pain, improve mobility, and reclaim confidence in daily life. This integration of neuroscience, biomechanics, and mindful movement exemplifies how a single, well-informed exercise can produce profound effects on both body and mind, offering seniors a path to relief that is immediate, natural, and sustainable. The third key principle in addressing sciatica pain over the age of 60 lies in the role of muscle strength and stability, a concept that often gets overlooked in discussions about nerve-related discomfort. The sciatic nerve is profoundly influenced by the surrounding musculoskeletal framework, particularly the muscles of the core, pelvis, hips, and lower back. When these muscles are weak or poorly coordinated, the structural support for the spine diminishes, and compressive forces are transferred to ligaments, discs, and ultimately the nerve itself. Over time, the imbalance created by muscular weakness or asymmetry exacerbates irritation along the sciatic pathway, creating a cycle of pain, reduced mobility, and further weakening. Strengthening and stabilizing these key muscle groups is therefore not simply about building visible strength. It is about reconstructing the body's internal scaffolding to protect sensitive tissues and optimize biomechanical efficiency. Muscle stability begins with the core, which includes the deep abdominal muscles, multifidus, diaphragm, and pelvic floor. These muscles form a cylindrical support around the spine, distributing forces evenly during movement and maintaining alignment. In older adults, natural age-related changes such as decreased muscle mass and connective tissue elasticity can compromise this support. Even everyday activities such as bending, lifting, or standing for prolonged periods can stress the sciatic nerve when core stabilization is insufficient. By performing a targeted exercise that activates these stabilizing muscles in a controlled way, the body can reinforce its spinal support system. This reduces unnecessary strain on the nerve, allowing it to glide freely within its anatomical canal and reducing the intensity of pain signals sent to the brain. The exercise is less about maximal effort and more about precision, alignment, and consistent engagement, which cumulatively rebuilds functional strength. Hip and gluteal muscles play an equally critical role in sciatic health. The gluteus maximus, medius, and minimus are responsible for stabilizing the pelvis, controlling leg movement, and absorbing impact from walking or climbing stairs. When these muscles are weak or inhibited, compensatory patterns emerge, placing greater load on the lower back and hamstrings. The sciatic nerve, which passes beneath or through the piriformis muscle, can become compressed if surrounding muscles are tight or unbalanced. A properly designed exercise addresses both activation and stretching of these muscles, releasing tension while simultaneously strengthening fibers that contribute to pelvic stability. Over time, this dual action reduces nerve compression and enhances coordination, illustrating the interconnectedness of muscular function and nerve health. Beyond isolated strength, neuromuscular coordination is essential. Older adults may develop inefficient movement patterns over decades, often subconsciously avoiding positions or motions that provoke discomfort. These compensatory behaviors create further imbalance, weakening stabilizing muscles and perpetuating tension along the sciatic pathway. Controlled exercise not only strengthens key muscles, but also retrains the nervous system to coordinate movement efficiently. By repeating specific patterns, the brain learns to engage stabilizing muscles automatically during daily activity, reducing the likelihood of strain and minimizing the recurrence of pain. This reprogramming of movement is a subtle yet profound mechanism that highlights how strength training and functional stability are inseparable from neurological adaptation. Flexibility and controlled stretching are also integrated into the exercise for sciatica relief, particularly in the hamstrings, hip flexors, and lower back. Tight muscles can pull on the pelvis and increase pressure on the nerve, while over-lengthened or weak muscles fail to provide necessary support. Daunted exercise balances these demands by lengthening tight fibers while activating weaker ones, creating a stable yet mobile environment around the nerve. This equilibrium reduces irritation, supports healthy joint mechanics, and allows the nervous system to function without restriction. The combination of strength, stability, and flexibility produces a biomechanically optimized pathway for the sciatic nerve, emphasizing that pain relief is as much about balance as it is about strength alone. The importance of gradual, progressive engagement cannot be overstated. Older adults, particularly those over 60, require an approach that respects tissue integrity and age-related changes in muscle elasticity and joint mobility. Sudden or high-intensity exertion can provoke discomfort, discouraging consistent practice. By emphasizing slow, controlled repetitions, the exercise allows muscles to adapt, connective tissue to remodel, and the nervous system to recalibrate without undue stress. Each session builds not only immediate relief but cumulative resilience, demonstrating that sustained, mindful activation of stabilizing muscles produces long-term protection for the sciatic nerve. Finally, the psychological impact of regaining strength and stability reinforces the physical benefits. Chronic sciatica often creates fear avoidance behaviors where individuals reduce activity to prevent pain, inadvertently weakening stabilizing muscles further. When a targeted exercise shows immediate relief and teaches control over the body, confidence is restored. This renewed trust in one's physical capability encourages more movement, which in turn strengthens the core and pelvic musculature even further, creating a positive feedback loop of mobility, stability, and reduced nerve irritation.
Wow.
The integration of muscular strength, coordination, flexibility, and mental confidence illustrates that sciatica management is not a singular intervention, but a multidimensional approach where muscles serve as both protectors and rehabilitative agents for the nerve. This perspective emphasizes that strengthening and stabilizing muscles is not merely about fitness aesthetics. It is an essential physiological strategy to relieve pressure on the sciatic nerve, restore functional movement, and reduce chronic discomfort. Through targeted, precise exercise, older adults can rebuild the internal scaffolding necessary to protect their nervous system, enhance neuromuscular coordination, and ultimately reclaim independence, mobility, and quality of life. The fourth key principle in managing sciatica pain focuses on circulation and vascular health, an aspect that is often underestimated, yet profoundly influential in both the intensity and duration of discomfort. Sciatica is not simply a mechanical problem. It is intimately connected to the health of surrounding tissues, the nerve itself, and the blood vessels that supply them. When muscles are tight, inflamed, or underactive, circulation can be restricted, limiting the delivery of oxygen and nutrients necessary for cellular repair and the removal of metabolic waste. Over time, this impaired blood flow exacerbates inflammation, prolongs nerve irritation, and slows the body's natural healing processes. By incorporating targeted movement into a sciatica relief routine, circulation is enhanced, creating a physiological environment that supports rapid recovery and long-term resilience. The connection between movement and vascular function is critical to understand. Gentle, controlled exercises, particularly those focused on the lower back, gluteal muscles, hips, and legs, stimulate blood flow to the areas surrounding the sciatic nerve. This increased perfusion delivers oxygen-rich blood and essential nutrients to muscles, ligaments, and connective tissue, supporting tissue repair at a cellular level. Simultaneously, circulation helps remove inflammatory byproducts such as lactic acid and excess metabolic debris that can accumulate during periods of inactivity. This dual-function delivery of nutrients and removal of waste is fundamental to reducing local irritation of the sciatic nerve and improving functional capacity. The nervous system is highly responsive to the local chemical environment, and when inflammatory mediators are reduced, nerve signaling stabilizes, diminishing the intensity of pain perceived by the brain. In addition to local circulation, systemic vascular effects play a role in sciatica management. Movement of the lower body and core stimulates venous return, encouraging the efficient movement of blood back toward the heart. This effect not only reduces fluid buildup and edema in the legs, but also improves the overall metabolic environment of the lower back and pelvis. Improved systemic circulation ensures that tissues are continuously nourished and that the inflammatory cascade is less likely to be sustained, creating a healthier foundation for neural and musculoskeletal recovery. The principle here is simple yet powerful. Motion drives blood flow, and blood flow drives healing. By integrating this understanding into a daily exercise routine, the body is supported in its natural capacity to repair and maintain itself. Furthermore, the relationship between circulation and nerve health is direct and significant. Nerves require constant oxygen and nutrient supply to maintain their electrical conductivity and functional integrity. Compromised blood flow can exacerbate nerve hypoxia, making the sciatic nerve more sensitive to mechanical pressure and increasing pain perception. By performing targeted exercises that enhance circulation around the nerve, oxygen delivery improves, supporting nerve metabolism and reducing hypersensitivity. This creates a feedback loop in which improved vascular health directly contributes to decreased nerve irritation, enabling the nerve to glide freely without provoking sharp pain. In essence, enhancing circulation is not just a supportive measure. It is a central mechanism by which nerve function and comfort are restored. The exercise itself is designed to optimize both muscular contraction and vascular activation. Gentle, rhythmic contractions of the glutes, hamstrings, and lower back stimulate local arteries and capillaries. While slow, controlled movement encourages venous return, the result is a balanced circulation that addresses both oxygenation and waste clearance. Importantly, this approach is safe for older adults, as it avoids high-impact or strenuous activity that could stress the joints or overstretch tissues. Instead, the exercise harnesses the body's natural circulatory dynamics to produce meaningful physiological changes, demonstrating that even subtle low-intensity movements can have profound effects on tissue health and pain reduction. Hydration and tissue responsiveness complement this circulatory effect. Well-hydrated muscles and connective tissues allow blood to flow more efficiently and improve the exchange of nutrients and waste at the cellular level. Dehydrated tissue is less pliable, more prone to stiffness, and slower to recover from irritation. When combined with neuromobilization and strength-focused activation, enhanced circulation maximizes the benefit of each movement by ensuring that the affected areas are optimally nourished and capable of adaptive response. This highlights the integrated nature of sciatica management. Muscles, nerves, and blood vessels function as a cohesive system, and interventions must address all three simultaneously to produce rapid and sustained relief. Another critical aspect is the prevention of chronic inflammation. Reduced circulation contributes to the persistence of inflammatory mediators around the sciatic nerve, which maintains hypersensitivity and prolongs discomfort. By promoting vascular flow through targeted exercise, these mediators are cleared more efficiently, allowing the tissues to return to a balanced state. Chronic pain often creates secondary complications such as stiffness, reduced mobility, and altered gait patterns. Improving circulation counteracts these secondary issues, enabling a more natural and fluid movement pattern that protects the nerve from further stress. Over time, this approach not only alleviates pain, but strengthens the body's intrinsic capacity to maintain healthy neural and musculoskeletal function. Psychologically, enhanced circulation has additional benefits. The immediate warming and increased blood flow generated by movement can produce a sense of relief and comfort. Reinforcing the habit of performing the exercise consistently, feeling the body respond positively to movement encourages adherence, which is critical for long-term outcomes. As older adults observe tangible improvement, confidence in mobility is restored, fear of movement diminishes, and the nervous system is conditioned to associate motion with safety rather than pain. This reinforces the physical benefits of circulation at a cognitive and behavioral level, completing a cycle of integrated healing that combines physiological restoration with mental reassurance. Through the consistent application of exercises that promote blood flow, circulation emerges as a central mechanism for relieving sciatica. It addresses the root physiological conditions that exacerbate nerve irritation, supports tissue repair, reduces inflammation, and enhances both local and systemic nerve health. DAOs. By understanding and leveraging the intimate relationship between movement, vascular function, and nerve sensitivity, older adults gain a practical and scientifically grounded tool to manage pain, restore mobility, and reclaim the confidence to move freely without reliance on medications or invasive interventions. The fifth key principle in managing sciatica for adults over 60 emphasizes the psychological dimension of pain and the profound impact that confidence and mindset have on recovery. Chronic pain is not merely a physical phenomenon. It is an experience shaped by the interaction between the nervous system, musculoskeletal structures, and cognitive perception. When sciatica persists, the brain begins to associate movement with discomfort, and fear avoidance behaviors develop. Individuals may begin to limit their activity, subconsciously protecting themselves from potential pain. While this seems protective, it actually perpetuates a cycle of weakness, stiffness, and increased nerve sensitivity. The psychological aspect of pain, therefore, is inseparable from the physical mechanisms that sustain it, and addressing it is essential for meaningful, lasting relief. Engaging in a single, targeted exercise that reliably reduces sciatica pain can break this cycle by providing immediate feedback to the nervous system that movement is safe. Confidence in movement is reinforced through repeated experiences of relief. When an individual performs a precise, controlled exercise and notices a reduction in the characteristic radiating pain, the nervous system interprets the activity as non-threatening. This teaches the brain that certain positions previously avoided are in fact safe, thereby recalibrating the pain perception pathways. Over time, the fear response diminishes and natural movement patterns are restored. This neuropsychological adaptation is crucial for seniors who may have accumulated decades of movement habits conditioned by minor injuries, sedentary routines, or age-related stiffness. The exercise acts as both a physical intervention and a cognitive re-education tool, allowing the mind to relearn that motion is not inherently painful and that the body is capable of resilience. The restoration of confidence also promotes greater engagement in daily activities, which itself becomes therapeutic. When individuals begin to trust their bodies again, they are more likely to walk, stretch, and perform functional movements that maintain strength and flexibility. This creates a positive feedback loop. Movement reduces stiffness and improves circulation, which reduces nerve irritation, which further diminishes pain, reinforcing the individual's trust in their physical capacity. The psychological benefit of seeing tangible results cannot be overstated. Each successful repetition is a signal to the brain that healing and control are possible, reinforcing adherence to the exercise and encouraging broader lifestyle changes that support spinal health, muscle strength, and overall well-being. Another important aspect is the reduction of anxiety associated with chronic pain. Persistent sciatica often generates anticipatory anxiety, where individuals dread movement because they expect pain. This heightened sensitivity can amplify the perception of discomfort and lead to increased muscle tension, which further compresses the sciatic nerve. By experiencing reliable relief from a single, carefully executed exercise, the individual's anxiety diminishes. The nervous system learns that movement does not necessarily predict pain, and muscles begin to relax, decreasing mechanical pressure on the nerve. Over time, this dual impact on both physical tension and cognitive expectation helps restore natural gait patterns, posture, and the ability to perform activities of daily living without apprehension. The interplay between psychological and physiological factors is also evident in adherence to long-term pain management. Exercises that produce immediate relief motivate consistent practice, which is critical for maintaining benefits. Older adults who witness the connection between intentional movement and decreased pain are more likely to integrate the exercise into their daily routine. Consistency reinforces neuromuscular coordination, strengthens supporting muscles, enhances circulation, and further reduces nerve sensitivity. In this way, psychological reinforcement and physiological adaptation work hand in hand. Confidence drives adherence, and adherence produces measurable improvements that further bolster confidence. Mindfulness and body awareness are additional components that enhance the psychological impact of targeted sciatica exercises. When performed deliberately, the exercise encourages attention to alignment, muscle engagement, and nerve pathways. This conscious engagement fosters a deeper connection between the mind and body, enhancing proprioception, the awareness of body position and movement in space. Its improved proprioception reduces the risk of sudden or awkward movements that could exacerbate pain and allows for smoother, more controlled motion in everyday activities. By cultivating awareness alongside strength and flexibility, seniors can move with precision and confidence, minimizing both fear and actual nerve strain. Finally, the psychological benefits extend beyond pain relief to quality of life. Chronic discomfort often limits social engagement, recreational activity, and independence. By restoring trust in one's body, individuals regain the ability to participate fully in daily life. From walking outdoors to carrying out household tasks, without the constant interference of fear or pain anticipation. The exercise, therefore, is not just a tool for nerve health. It is a gateway to reclaiming autonomy, self-efficacy, and overall well-being. Confidence, once rebuilt, becomes a driving force for sustained movement, resilience, and active living, demonstrating that the mind and body are inseparable partners in the journey toward lasting sciatica relief and functional independence.